Earlier today, I gave you this patient and asked you what could be the cause of so much blood in the stool. Let's talk about it. Okay, so let's talk about this GI bleed. So there's a few reasons that you can have a GI bleed. So let's talk about one that's not nearly as serious, but still can cause blood and cause kind of an alarm, which is hemorrhoids. And hemorrhoids are basically outpouchings of veins right at the end of the anus, like so. And when they rupture, they can cause some bleeding that can cause a little bit of concern for patients. So that's one that that is something that we do get called from time to time. Other ones are kind of diverticulitis, which is a pretty common one that is going to cause pretty significant bleeding. And those are due to outpouchings in the large intestine. So this guy right here, or the ascending, transverse, or descending colon, we get pouching like this. And these pouches ultimately can get fecal matter and impaction in those particular pouches, like so. They get stuck. And what causes this, or causes a bleeding, is that when they rupture, they cause a rupture in this particular lining, meaning that significant bleeding can occur that can cause pretty major GI bleeds. This is actually a pretty significant medical emergency that we need to take care of and may need to start to resuscitate blood quite a bit in these particular patients, because there's technically an internal hemorrhagic shock that's happening here. Other things that can cause significant bleeding is cancers as well. Cancers of the colon can also cause a continuous bleeding too, which again is usually a smaller amount. So the major acute bleeds that we're typically dealing with are often diverticulitis that have ruptured, that have caused significant bleeding. But there are some other ones that can cause bleeding that we need to be aware of. But the biggest thing is look at your vital signs, see how they're doing from a shock state, and then you can decide your treatment path from there.